Hello, my name is Danielle Johnson, and my oral presentation is going to be on how to take a manual blood pressure. The two things that you will need to do a manual blood pressure is a stethoscope and a sphygmatometer. The sphygmatometer is basically your blood pressure cuff. Okay, the way that you work the sphygmatometer is you put it around the patient's arm, and you make sure that the arrow is over their brachial artery. Later on, I'm going to show you how to find that. You make sure that it's on their arm, not too snug, not too loose, or it'll give you an inaccurate reading. Okay, this is your air valve. Your air valve, when you want to pump up the blood pressure cuff, it needs to be closed. The way that you close it is you turn it clockwise, and you start to pump it up. Okay, to release the air, you turn it counterclockwise. It'll come out by itself, but since I'm showing a demonstration, it's going to do this. Okay. Close it back. The way that you read this sphygmatometer is the small lines are 2, the medium-sized lines are 10, and the long lines are in increments of 20. The other instrument that you will need is your stethoscope, and this is what you use to hear the blood pressure. Okay. To find the brachial pulse in your arm, it is on the inner part of your arm, just inside of your elbow. Some people it's difficult to find. Okay, now I'm going to demonstrate how to take a manual blood pressure. When you're pumping up your bell, you want to go between 160 and 180. And then slowly release the air. The first sound that you hear is your systolic number. And the last sound you hear is your diastolic number. Your blood pressure was 132/72. That was my presentation on how to do a manual blood pressure. Thank you for watching.